Good afternoon, everyone. My name is Frincy Ibarrientos, a Bachelor of Physical Education student. I will discuss the last part of our report, the Community Health and Environmental Health, under the PEMC 314. So this is the topics outline. First, we will discuss the concepts of community health, the characteristic, the nature, and prevention and management. And also, we will discover what is the environmental health for the community injury control, community waste and water control, and the last is the epidemiology of waterborne diseases. So let us now start. Community health, concepts of community health and environmental. So let us define first what is health, so we can understand the whole word. Health, a state of complete physical, mental, social, and emotional well-being, and not merely the absence of disease or infirmity, and the ability to lead a socially and economically productive life. So that is based from the WHO, the World Health Organization, and that is the definition of health. So health is just a well-being of being in a good state, and then parang hindi lang siya yung sa physical, but holistically. So you are healthy physically, mentally, socially, and emotionally. So let us now define what is the community. Community defined as a sociological group in a large place sharing one environment. It includes the individual and the family. So community is the group of people of a larger society that shares the same or common characteristic or interest of the people. So it's not just the interest and characteristic, but also the attitudes. Maipapansin natin sa isang lugar, parang pare-parehas sila ng mga ugali din, ng mga interest din, and ng beliefs din, syempre ang mga pinapaniwalaan din nila. So katulad dito sa Pilipinas, dito sa Bicol is mahilig tayo ng Bicol Express nga ganon, or mga anghang. So that is the community here in Bicol, but in other places is iba naman yung community na pinapakita nila. So that is the community itself. Yan. So next slide is the community health. So pinag-isa na yung word. So community health, the art and science of maintaining, protecting, and improving the health of all the members of the community through organizing and sustain community efforts. So with the word community, the group of people with health is being healthy or in overall well-being. So that is the community health. So this community health has the aims to address factors and promote the overall well-being of communities. So that is the concepts of community health. So there are factors nga yan. There are 3 factors. First is the socio-economic. Yan. Socioeconomic is poverty, lack of education, and limited access to healthcare can all contribute to poor community health outcomes. So, parang ano na to, related na yung status natin with um, paano ang kakayahan natin in financial, kung ano yung state natin in the community. Because syempre, iba-iba rin naman tayong mga estado sa buhay. Kunwari yan, middle class, the low, meron tayong middle, low, and high. So, it is based on the work or on how we measure the person's economic and social position. So that is the socio-economic factors that can affect the community health. Next is the environmental factors. Environmental factors, exposure to pollution, contaminated water, and hazardous waste can have detrimental effects on community health. So that is one of the factors, lalo na kung yung lugar nyo is in depende in water, malapit ba in water side or land ba siya or mountain na unit ba siya, ganon. So that is the one of the factors on that can affect the community health. Next, lastly, for the factors is the behavioral factors. Unhealthy lifestyle, such as smoking, physical inactivity, and poor diet can increase the risk of chronic diseases in communities. So, hindi lang yung socio-economic ang makaka-apekto, and hindi lang din yung environmental na tinitirahan ng grupo ng mga tao, but also on how they live their lives. Because syempre, ang life mo is your choice. Ikaw pa rin ang nakakapag-control. So kahit ang socio-economic mo is low, kung ano lang yung pwede mong makuha is yun na lang din. And then kung yung environmental factor mo naman is nasa ilog ka nakatira, and then polluted yon, is hindi lang is parang kung yung behavior mo lang din naman ang makaka-apekto, is parang it is your reason, it is your parang kasalanan mo lang din, parang ganun. So hindi lang yung socio-economic, hindi lang environmental, but also the behavior. Kung maganda naman yung socio-economic mo, halimbawa sa mga mayayaman, high socio-economic sila, so they have the power to buy things, ganyan. And then kung environmental naman, yun na, high socio-economic naman sila, is maganda yung bahay nila, naka-aircon, ganyan. But in their behavior naman is parang inaabuso naman nila yung kakayahan nila, is wala lang din naman. So as a whole in this factors, we need to sustain it for our community health lang din, hindi lang individual but for the other people din. Yeah. So next, environmental health. It comprises those aspects of human health that are determined or by physical, chemical, biological, social, and psychosocial factors in surrounding environment. Key aspects of the environmental health include, so let's first explain the environmental health. So environmental health is where kumbaga parang ito na yung nasa kanina nga 'di ba yung pinag-usapan natin yung environmental factor. So this is the time that we emphasize on how we improve our health by taking care the environment. So yan ang ng environmental health. So we have the key aspects para parang bumubuo doon sa environmental health, like air quality, water quality, hazardous waste, and climate change. So this is a current trends right now, lalo na yung climate change nung nakaraang months. And then also for the yung sa pandemic nga ganyan, pinag-usapan talaga yung climate change ng time na yun. So let us define the air quality. Poor air quality caused by pollution from vehicles, industries, and other sources can lead to respiratory problems, heart disease, and other health issues. So, di ba parang yung karamihan sa atin is we preferred to live in probinsya. So sa rural because yung air quality naman talaga is high. So kasi in urban areas kasi we have the vehicles, we have the factories, and then the building. So we have no chance to have the high quality of air that we need in our body. So yan naman yung disadvantage in urban areas. So we need to take care of the environment by planting trees para naman is high air quality ang matanggap din natin as a human being that is living in this earth. So yun yung air quality naman. And then sa vehicles naman, 'di ba nung pandemic is na parang na quarantine tayo, ganyan, na isolate tayo. So that is the time na pagpahinga naman yung earth na parang walang dumadaan na vehicles that contribute poor air quality because of the smoke and on its machine, ganyan, parang yung inaano ng usok ng mga sasakyan. So parang ang ganda din sa feeling. And then we appreciate the nature itself. Yun naman yung parang good side ng pandemic time. So next, water quality. Contaminated water can cause a range of health problems, including diarrheal diseases, waterborne infections, and neurological disorders. So later on, waterborne diseases, we will talk it about in the last session. Yeah. So water quality naman, parang yun na yung save water, yan. So yun naman yung natin ang pinopromote ng government na save water, and then but in this time, parang din naman, parang mahirap magkaroon ng high quality water because parang kahit tayo hindi tayo nakakainom, baka ako lang, but ako nakakainom ako sa nawasa if malamig siya. So kung hindi, parang hindi ko siya kayang inumin na parang yun lang talaga, na kasi iba yung lasa niya kaysa sa mineral water, or baka talaga nasanay lang ako. So yun naman yung parang kahit tayo is hindi natin masisiguro talaga na kahit dyan sa faucet is malinis, parang ganun. And then minsan kasi kapag yung water is madumi or ganyan, is nagkakaroon tayo ng LBM, yan, mga infections, yan, diarrheal diseases. So sumasakit yung tiyan, ganyan, lalo na kung maselan ka, diba? So yun, so that is the water quality naman. Next is hazardous waste. That is the exposure to hazardous waste can cause cancer, birth defects, and other health problems. Yan. And lastly is the climate change, rising temperatures, extreme weather events, and changes in ecosystems pose significant risk to human health. So that is the factors, key aspects of the environmental health. So yan naman yung mga yung climate change, yan yung pagpapaalaga natin sa Mother Earth, like yan, planting trees, kahit yung paggamit din natin ng kuryente is like the greenhouse gases. So it is also connected with that climate change. So that is the concepts of community health and environmental health that intertwined. This is connected. The two concept is interconnected and essential for understanding the well-being of individuals and population. Yeah. Next is the characteristics of healthy environment. So now we know about the concepts. So paano naman natin malalaman kung healthy yung isang environment? So meron tayo niyang categorize the physical environment, psychosocial environment. First, in physical environment. Physical environment has a clean and safe environment. Clean and safe physical environment. Yan. So, yan parang kunwari yun na yung sa environmental factors natin is we have the air quality, the water quality. So we can consider it a healthy environment if it is safe and then clean. Next, an environment that meets everyone's basic needs. Yan. Kunwari, parang yun na yung air quality, diba? So that is the basic needs of the people in a community. An environment that promotes social harmony and actively involves everyone. Yan. So, kunwari sa mga barangay. So, in that, we can consider it a healthy environment when it supports social harmony and actively involves everyone. Kunwari, may mga program, yung kahit yung mga sa SK, kunwari yung basketball, paligan nila. So, yun, social harmony na rin yun and actively involves everyone. Next, a community that participates in identifying local solution and local problems. Kunwari, sa barangay ulit, we have the kunwari yung sa teenage pregnancy and then the sexual health. So may mga seminar, may mga palibreng mga birth control pills or mga pwede nang magamit ng yung mga couple or married couples na pwede nilang magamit for a healthy sex. So, yan. Yun naman yung example doon. Next, accessible and appropriate health services and facilities. So, next, again, sa barangay pa lang is dapat meron talagang barangay health services pa lang. If para naman is in a smaller group ng community is magampanan, parang ma-prevent na natin agad-agad yun. So, yun pwede natin ma-consider na healthy environment yun. If that community has the health services, katulad nitong Naga, is we have a public hospital like a BMC. So, yun naman yung maganda doon. Next, a diverse and innovative economy. Yan, na hindi pabagsak yung ekonomiya, diba? Is dapat pataas pa rin siya and then nagre-regulate. Yun naman yung pwede nating healthy environment. It is connected with it. Kasi, syempre, sabi nga kanina yung dun sa community health natin is parang apektado yung socio-economic. Next, lastly, for the physical environment, a sustainable use of available resources for all. Kunwari, food, rice, 'di ba? Sa Iriga, we have other barangays na may mga talaga, mga taniman, ganyan. So, we have, yan nga yung namin sa ni Papa San Antonio is, we have the sustainable use of rice. Kasi, in our community is, nagaano pa rin siya, nagpo-produce ng palay pa, ganun. So, we consider it a healthy environment is we can go back to the second characteristic which meets everyone's basic needs. So that is the physical environment. Next is the psychosocial environment. Number 1, the promotion and celebration of historical and cultural heritage. So psychosocial naman, it refers to the interrelation of social factors and individual thought and behavior. So hindi na siya physically, parang sa mentally, ganyan, and emotional. So and also socially. So it promotes and celebrates historical and cultural heritage, like we can consider the festivals like the Peña Francia, the Tinagba, the other festivals in other community. So that is on how we can consider healthy environment. Kasi nga hindi natin mako-consider na healthy ang isang tao if it is only physically. So it involves the overall well-being. Yeah. Next, a community whose members have access to varied experiences, means of interaction, and communication. Lalo na yung mga, kunwari, sabihin na natin yung introvert, ganyan. So, may mga introvert talagang mga bata pa lang is may hiyain na, parang ganon. So, we, in a family, yan. Kasi because in a community, it's always start with the individual and also in the family itself. And then, parang doon pa lang sa family na yun is as a parent or as a guardian, you should encourage your children to have interaction with other children in that community so that she or he will experience what she or he deserve naman. Lalo na kapag yun nga, yung di ba bata pa lang, is nag-develop yung social skills niya. So, it is a need, di ba? Para naman, kasi parang soft skills na to di ba? So, communicating this kind of skill is necessary para lalo na kapag lumalaki yung bata is magagamit niya yun, 'di ba? Lalo na sa trabaho, 'di ba? It is parang kailangan natin to lalo na kapag nagtrabaho ka na is doon pa lang parang i-improve yung emotional intelligence mo pa lang. Yun. Next, respect for diversity and inclusion. So inclusivity, halimbawa natin is in a community mayroon tayong mga Muslim na nagtitinda, 'di ba? Ng mga sa case niya ganyan. So we na Catholic is we respect them. Na parang we welcome them in the community kahit iba yung interest nila. So in a community parang it doesn't mean na different sila, is we not parang if they are different, hindi yun ang basehan para hindi sila tanggapin doon sa community na yun, sa society. But we need to respect them and to know them better so that we can consider the community a healthy environment. Yan. And then inclusion, yun nga, parang ito rin yung yung series sa I1TFC ni Andrea Brilliant na parang nag-drag queen siguro siya nun. Kasi yung pamilya niya is mga bakla. Yan, mga nagda-drag queen, ganyan. So, bale, parang naglipat sila ng barangay or parang yun yung kwento doon. Naglipat sila ng barangay tapos parang yung barangay na yan is homophobic, ganyan. So, we can consider that a healthy environment if the community itself has the respect for the new people that can be part of the community. Yan. So lastly, ensures the individuals feel comfortable in expressing themselves, taking risks, and learning without fear of judgment and reprisal. So yun na nga, parang ano din to, parang related din siya dun sa last, sa second to the last, which is the respect for diversity and inclusion, na yung mga new group of people na yun, new family na yun, nakabagong lipat pa lang sa barangay na yun, is they can consider that a healthy community or healthy barangay if they feel comfortable na parang walang masama, hindi sila makakaramdam ng masama or wala silang mararamdaman na risk or danger dun sa ano yun, na parang wala sa kanilang mananakit dun sa community pa lang yun. So this is necessary essential, important nowadays because maraming mga babae or sabihin na natin, hindi lang babae, all genders, maraming mga kabataan na nakikidnap or na-rape, ganyan, because the community itself has parang hindi sila makaka-feel ng safety kasi hindi healthy environment yung community itself. So yan, malaki talagang talaga yung characteristic ng healthy environment, hindi lang physically but psychosocial pa rin. Next, our government. I added this because parang additional idea. Yan. Our government believes that a strong nation needs a healthy citizenry. To achieve this, the Department of Health promoted community health with partnership of community, barangay, government, and non-governmental organization through a program called primary health care. So, kanina, di ba, merong sa physical environment is meron tayong mga dapat health services, di ba, and facilities. So, the government has the action na which is the primary health care. So, under that, we have the health center services. So, hindi lang sa as a general, but for a maternal health care, child health care, lalo na kapag yung mga newborn, di ba may mga mga paturok na yan, ganyan. So, yun, may mga libre lang din na ganun sa iba-ibang barangay. And then, nutrition program, population and family planning program, control of communicable diseases, environmental sanitation program, control of communicable diseases, dental health program, yan, reproductive health care, medical morbidity clinic, national voluntary blood services, lalo na dito sa Ateneo, di ba? Is meron tayong voluntary blood donor, kaya ganyan. Epidemiology and surveillance program, disaster management, lalo na kapag may mga disaster na flood, earthquake, so dapat andyan yung health center services. Preparedness program, dental hygiene and pharmacy services. So that is under the health center services. So dito rin nasa Ateneo is meron din tayo niyan, which we are paying for the medical fee. Yan, parang mga 300 pesos siguro yun or 600. Di ko lang sure. Basta may medical fee tayo sa matriculation na pinabayaran. So yan, If you have need, we can seek for the professional health providers. We have the barangay, the city government, LGU, and then maraming pwedeng malapitan. But syempre kapag na din talaga is kailangan talaga ng pera pa rin. Yun naman yung disadvantage. And then also in other barangays kasi talaga, in other areas, hindi naman talaga to na i-implement ng maayos, since ang problema din naman is financial din, facilities, so mahirap din talaga sa ibang lugar, lalo na kung walang public hospital. Parang dun sa Iriga City, we only have private hospitals doon. So, yun naman yung mahirap doon. So, yan yung our government. Next part, the nature and health effects of environmental issues. Pollutants in the environment or climate-related events can have massive impact on our health. Air and noise pollution can have air and noise pollution and heavy metals like mercury and are directly related to health issues like asthma, hearing loss, dehydration, and heart disease. Heat waves and floods affect the whole population but cause the highest burden to vulnerable groups like infants, the elderly, those in poor health, or communities living in floodplains. So this is para events na situational na minsan hindi natin control, lalo na yung flood, earthquake, volcanic eruption. So that is the nature. So ang tanging nating magagawa is also the government talaga, the healthcare services na andyan pa rin na makaka-prevent ng community health. So yan naman yung dito sa nature and health effects of environmental issues. Next, air pollution is the single most important cause of environmental health hazard affecting millions of people in the world. Air pollution can cause lung and heart disease and premature deaths. So, as a people of the society, we need to take care talaga our home, which is the earth, because on our action, sabihin na natin na ako lang naman ang nagtatapon ng mga basura kahit saan. But in that action pa lang is nakakaapekto tayo sa karamihan. Yun naman yung we can be part of the solution, but we should not be part of the problem. So that is the air pollution. Next is the health of a community is significantly influenced by the environment, and environmental factors can directly impact the health of individuals and communities. For instance, exposure to air pollution can increase the risk of respiratory illnesses such as asthma, bronchitis, and pneumonia, because air pollution targets the lungs. Next, contaminated water can cause diarrheal diseases, waterborne infections, and neurological disorders, particularly in vulnerable populations. Napag-usapan din natin yan sa water quality. Next, exposures to hazardous waste can lead to cancer, birth defects, and other serious health problems. Lastly naman is the climate change pa rin. We talk about this in the key aspects of the environmental health. Can cause heart-related illnesses, respiratory problems, and increased transmission of infectious diseases. Lalo ng kapag sa sabihin na natin yung flood, it is not our control, but before the flood, we have the control. Halimbawa, we can prevent it by planting trees to have the control of the flood para may makasipsip ng tubig na hindi tayo parang, binaha tayo ng one day. But pagkatapos ng bagyo, parang dapat umaano na siya, parang bumababa na yung tubig because we have trees. Parang gano'n. Nakakatulong din naman kasi siya kahit in a small effort lang. So that is the nature and health effects of environmental issues. Next, we have the prevention and management of environmental issues. Prevention is the most effective approach to mitigating environmental damage and safeguarding the environment for future generations. Implementing preventive measures can help reduce the severity of existing environmental problems and prevent new ones from arising, because hindi natin may iwasan talaga ang problems or kumbaga parang ang mga pollution na yan, yung mga factors na pwedeng maka-apekto sa community health, we can prevent naman yun. So, sabi nga nila is prevention is prevention is better than cure pala. Yan. Yan. Under that is we have the sustainable resource management, which it adopts the sustainable practices in resource extraction, utilization, and disposal for a crucial or conserving the natural resources and minimizing the environmental impacts. Next, environmental protection laws and regulations. So it involves the laws and regulation that is essential for protecting the environment from harmful activities. So, sabi nga doon kanina, we have the factors, which is the behavioral factors. So, meron tayong mga laws and regulations. Next is public awareness and education. We have the seminars in different barangays. Where it promotes environmental education to foster a culture of sustainability and encouraging the people to have a responsible behavior. Next is technological advancement, where we are here in 21st century, where it developing and implementing innovative technologies can provide solution to environmental challenges. So here, we need technology to ease up the solution. But first, syempre, dapat alam natin kung paano natin gagamitin ang technology. Lastly, international cooperation. Addressing environmental issues often requires the international cooperation and collaboration because it's shared knowledge that can facilitate collective action and promote sustainable practices on a global scale. So that is the prevention and management. Next is the effective management of environmental issues is crucial for minimizing their negative impacts and restoring the environment. So we have the environmental monitoring and assessment. So we need to do this regularly, where it is essential for identifying and understanding environmental problems. So it is effective for managing that has strategies and tracking progress. Next is pollution control and remediation. So it implements pollution control measures such as air and water filtration systems for reducing pollution and mitigating its impacts. So next, conservation and restoration efforts. It conserve the natural habitats, endangered species, and biodiversity that is essential naman for maintaining healthy ecosystems. Yan. So, it can help recover degraded ecosystems din. Next, adaptive management. This often requires an adaptive approach as environmental conditions na can change over time. So this is a strategy based on new information and changing conditions for effective environmental management. Lastly, the community engagement and participation, where it involves the community itself to manage the environment that enhance the effectiveness and sustainability of the efforts. So it provide valuable insights, foster a sense of ownership, and promote sustainable practices. So that is the prevention and management of environmental issues. Next, we have the community injury. We are now in the environmental health. Yan, malapit na tayong matapos. Objectives of community injury control. It reduced the incidence and severity of injuries. And next is minimize the burden of injuries on individuals, families, and healthcare system. Lastly, improve the quality of life for those affected by injuries. So in here, it is critical public intervention that can significantly reduce the burden of injuries and improve the overall well-being of communities by addressing the root causes of injuries, promoting safe behaviors, and fostering a culture of safety that we can create safer and healthier communities for all. So it has a comprehensive and multifaceted approach to prevent and reduce injuries in community. So it involves the identifying and addressing risk factors din for injuries. So that is the objectives of community injury control. Next is the key elements of community injury. We have the surveillance and data collection, syempre. Next is the risk factor and identification and assessment, where we monitor nga yan. Intervention and development and implementation, where we identify and address. Syempre, we have the implementation naman. Enforcement of laws and regulations. Yan yung kanina din, di ba? Yan, tama. Public awareness and education, where yan nga, meron tayong environmental education na we can share in the community. Community engagement and empowerment, where we encourage the involvement of the people in the community. So that is all for the community injury control. Next is community water and waste control. Here, we will discover the challenges in community water and waste control. So we have the geographic diversity and the rapid urbanization and limited infrastructure. So in the geographic, meron tayong yan, the Philippines is an archipelago of over 7,000 islands. Now, it poses challenges in providing equitable access to clean water and adequate sanitation facilities. So it particularly in remote and mountainous areas. Lalo na yung mga have the low socio-economic status. Next is rapid urbanization. It is rapidly changing the environment itself. So it grows population concentrated in these areas. So it puts a strain on existing high quality water and sanitation infrastructure, leading to overcrowding, water shortages, and improper waste disposal. Lalo na yung mga walang mahina yung sa faucet, di ba? Yung parang wala nang lumalabas sa faucet because water shortages na siya. So lastly is the limited infrastructure. Many communities, especially in rural areas, lack adequate water treatment facilities and sewage system that result for contaminated water sources and improper waste disposal. So it poses to a serious health risks. So next is the initiatives and best practices. Community-based water supply and sanitation with CBWSS programs. So these programs empower communities to manage their own water and sanitation systems that promote local ownership and sustainable practices. So that is the CBWSS programs. Rainwater harvesting. So it promotes to capture and store rainwater for domestic use, reducing reliance and scarce groundwater sources. So we can say, kumbaga parang pwede tayo makatipid sa water na pwede, kunwari, kung plantito ka is ang pangdilig mo ng mga halaman mo is pwedeng yung rainwater. Yun. Which pwede tayong ng timba ngayon or drum na kapag umuulan is iano lang natin yun sa labas para makapag-ipon ng rainwater. Yan. Next, waste recycling and composting. Initiatives are being implemented to encourage waste recycling and composting, reducing the amount of waste going landfills, and promoting sustainable waste management practices. So in proper waste management naman to, na dapat alam ng tao kung paano mag-segregate, yan, on how we will consider it the trash as a recycle. Lastly, the information, dissemination, and education. So yan pa rin yung public awareness and education in an environment that being conducted to promote water conservation din, proper waste disposal practices, and the important for the physical environmental health, the hygiene practices talaga within the self. So that is the community water and waste control. Last part of our report is epidemiology of waterborne diseases. So in the Philippines, waterborne diseases are one of the most common causes of diarrhea, and they remain one of the top 10 causes of morbidity and mortality through the full extent and cause of waterborne diseases are known, and it is estimated by the significance. So this is from the DOH 2019. So waterborne diseases, yan yung parang It particularly in the areas with limited access to safe water and sanitation. So, sabihin na natin, saan ba dapat? Ano bang ang example is, sabihin na natin yung nasa laylayan. Yung ano sila sa ilog, nakatira, water. And then, yung water na nakokaan lang nila is yung ilog mismo. But, it is polluted. So, that is where the waterborne diseases come caused. Na parang in here, parang wala silang, no choice sila, but they have the limited access for a safe water for their basic needs. So, it requires a comprehensive approach that focuses on prevention, syempre, control, and then surveillance. So, in the Philippines, it can reduce the burden of these waterborne diseases and improve the health of its citizen by addressing it, to control it, yan, and to have the certain programs of the government that can solve this kind of problems. So, under the types of waterborne diseases prevalent in the Philippines, under that is diarrheal diseases. So, we will focus on the Philippines para hindi na tayo lumayo. Para din makarelate din tayo, real life situation. So, in here, diarrheal diseases. So, kahit sa bagay, parang ano lang naman to, minor yung nararamdaman ko yan kapag nasa nawasa. So, pero in here, parang kahit maliit siya, is mayroon pa rin siyang epekto talaga sa tiyan. So, we cannot sure na yung sa nawasa pa lang is malinis na. So, in this, it caused by the pathogens such as the rotavirus and the Escherichia coli or E. coli and Shigella. Shigella is Shigella or Shigella, Shigella. So that is the diseases for a diarrhea. Yan. Next is the typhoid fever. This is a serious bacterial infection na can cause Salmonella typhi and is often transmitted through contaminated water sources. So, merong iba-ibang bacteria na contain sa water. Lalo na yung kapag sa mga kunwari, kung contaminated yung water, syempre meron siyang merong mga iba-ibang bacteria doon and viruses. So, sabihin na natin yung sa flood, meron yun yung sa daga, di ba? Anong tawag doon? Yung the leptospirosis, yan. Where it is a bacterial diseases that occurs worldwide and can cause serious illnesses such as kidney and liver failure. Yan. And next is the hepatitis A, where it is a viral infection, causes inflammation of the liver and is spread through the contaminated water and food. So lastly, the cholera. So it is parang uso to noong panahon dati. Kasi because parang meron tong history. Ang alam ko meron kasi may video nun si mama na pinanood ko. So it is all about the cholera. Hindi lang sa water siya but in food din. Na yung panahon kasi 'di ba yung parang hindi pa uso yung pagluluto, parang raw yung kadalasan na mga kinakain. So yung paghugas pa lang, yung hygiene practices is hindi siya parang hindi siya uso doon sa community na yun. So, it leads to cholera. Lalo na kapag yung pagkain hindi siya hinuhugasan. Yun. Lalo na yung mga gulay or prutas lang, ganyan. Is pwede result to cholera. That cause the diarrhea din and dehydration. Kasi ang cholera parang yung pagtatairin yan, pagsusuka, ganyan, na parang di mo maintindihan sa tiyan. Parang diarrhea siya, pero mas malala. Parang ganon. Yun. So that is the types of waterborne diseases. Lastly, the epidemiology of water diseases in the Philippines is complex and varies depending on the specific pathogen, location, and environmental factors. However, some general trends can be observed. Like children under the age of 5 are disproportionately affected by waterborne diseases due to their immature immune systems and increased susceptibility to infection. So, maselan to sa mga bata pa lang. Lalo na, di ba parang ina-advise ng mga doctor is dapat mineral water talaga yung binibigay sa kanila. Kahit ang pagtimpla ng gatas is dapat mineral water siya. Hindi advisable ang nawasa. Yan. Waterborne diseases are more prevalent in rural areas than in urban areas due to limited access to safe water and sanitation. Kasi mahirap sa kanila yung water. Kasi in rural areas, para ito naman yung living in rural areas. Kasi, di ba poso yung sa kanila? And then, lalo sa mga mountain areas, parang yung ilog lang ang nila, parang source of water. Mahirap sa kanilang magkaroon ng nawasa. Parang ganon. So, parang sa kanila, kahit sabihin na natin nature yung sa water. But, in this generation, our bodies of water are already polluted talaga. Yun. Lastly, is outbreaks of waterborne diseases often occur following natural disasters and disruptions to water treatment system like floods, diba? So, in the prevention and control strategies for waterborne diseases in the Philippines, we can improve to safe water and sanitation where we can prevent it, where it involves investment in infrastructure, promoting hygiene practices. Kasi importante pa rin talaga ang hygiene practices by washing your hands before and after eating and ensuring proper water treatment and distribution system. Na ang pagtapon pa lang ng basura, 'di ba? And also in the factories, saan nila ang mga waste nila, 'di ba? So ang iba sa water talaga. Sa bodies of water natin, kunwari in the sea, in the river. So it will also leads talaga in a poor water quality. Next is the vaccination. Vaccines are available for some waterborne diseases such as typhoid, fever, and hepatitis A. So it provide effective protection against these diseases. Surveillance and outbreak detection. Because this way we can monitor the trends of the waterborne diseases and promptly detect outbreaks are crucial for implementing timely control. Lalo na kunwari yung community na yon is nagkakaroon, mostly sa kanila, meron kunwari 10 cases of diarrheal diseases. So, in this way, we can monitor that community kasi alam natin kung paano i-address yun in a surveillance and outbreak detection. So, lastly, the public education and awareness. So, all this, community health and environmental, leads to an education of the community itself, where it raised the public awareness about waterborne diseases in their risk, on how we prevent it, on how the control is, on how we manage it, where we can manage it during experiencing these waterborne diseases that has the measure that can help promote behavior change and reduce the risk of transmission. Going back to the factors of the community health, we have the behavioral factors. This all starts with ourselves pa rin. So, yan. So that is all for the prevention and control strategies for waterborne diseases in the Philippines. So this is my references. And 1 hour na tayo. And thank you for listening. I hope you all learn a lot of things about the community health and environmental health that can be a tool na para maging aware din tayo sa kanya-kanya nating community, lalo na magkakaiba tayo ng mga tirahan. Yan. So, thank you for listening and learning. Thank you. Once again, my name is Frincy Ibarrientos. Thank you and good afternoon.